what you see in the picture there, what that picture represents to any of you? Well, that's Brittany Maynard and her wedding picture, a snapshot of her wedding to Dan Diaz. And she's now the face of assisted suicide, physician-assisted suicide, as of last year. I was compelled to follow her story when I realized that she decided to end her life on November 1st last year, because that was my birthday. To me, that was a happy event, but for her, she was making a choice to end her life. 1 year after this picture was taken, the wedding picture was taken, she was diagnosed with a glioblastoma of her brain. And within 9 days after the diagnosis in January last year, she went in and she had a partial craniotomy and a partial resection of the temporal lobe. But only to learn April 2014 that not only was a tumor back, it was more aggressive. And in an article that Brittany wrote, she stated, it was October 7th, 2014 at CNN.com. She said her life had devolved into hospital stays, doctor consultants, and medical research. This afternoon, I hope to persuade you to support Senate Bill 128, the End of Life Option Act. The problem today with physician-assisted suicide is the awkward place it occupies in society. It's not quite murder, not quite suicide, and it makes us all feel very uncomfortable to talk about. Compassions and Choices filed a lawsuit just this week on behalf of 3 plaintiffs who are terminally ill. One of the plaintiffs actually was a former LAPD officer, and she's a civil rights attorney. The reason she would like to be able to end her life, she's dying of cancer, lung cancer, and she's got a 20-year-old daughter. Being a former police officer, she knows if she ends her life, that her daughter will be questioned. Although she doesn't want her daughter walking into her house and fighting for the dead deceased. So that is why she's fighting so hard. Brittany also, in the last 10 months of her life, she worked with Compassions and Choices in campaigning for the right to choose dying with dignity. This afternoon, I'd like to explain to you the harm created by the ban on physician-assisted suicide in California. Then I'll explain to you why physician-assisted suicide is illegal in California. And finally, I'd like to be able to try to persuade you why Senate Bill 128 should be enacted law in California. The ban itself in California, it creates individuals who are terminally ill. It causes them to have to endure painful death at the end of their life. Also, it forces their families to watch them suffer at the end of their life. According to a 1991 Boston Globe survey, most of the time, individuals consider the option to end their life not because of the pain they're experiencing, not because of the restrictive lifestyle, and not because they're dependent on machines, but rather they don't want to burden their families. The physician-assisted suicide ban problem is that in California, 2/3 of the majorities from every demographic subgroup support the freedom of terminally ill people to exercise the end of life option. Another ban issue problem is Medscape conducted a survey which stated most American physicians also support the measure for patients with incurable and terminal disease to end their life, to have that option. I've explained some of the problems with the ban on physician-assisted suicide in California. Now I'll explain why PAS, physician-assisted suicide, is banned in California. Physician-assisted suicide is legal due to a mix of events or things: politics, historical legal precedent, and black letter of the law. Homicide is illegal except in certain circumstances, like self-defense or in defense of others. California has outlined homicide of oneself or suicide. In June 1997, in the case Washington versus Glucksberg, the U.S. Supreme Court held that state laws banning physician-assisted suicide is not unconstitutional, although they left the constitutionality of a right to a physician's aid in dying be left with each individual state. Ira Bach, a physician, in an article out of the LA Times dated January 30th, 2015, stated he shared the sense of anger, urgency, and frustration in the sorry state of the end-of-life care. Last fall, in the Institute of Medicine report, Dying in America, detailed the deficiencies in medical training and practices which constitute or contribute to the needless suffering. Like women's rights, voting rights, gay marriage, it's only a matter of time before physician-assisted suicide becomes legal. And according to Ira Bach, it's the right thing to do. I've explained why a physician-assisted suicide, why there's a problem with the ban, and the reasons why we need a change. Now I will explain to you what needs to be done to resolve the current state with the law. Senate Bill 128 is the end-of-life option proposed by Senators Bill Monning and Louis Wolk. It's right now currently for the judicial vote. They're going to take the vote on June 5th. Right now, it's just passed the Appropriations Committee, but we still need to notify your individual senators and let them know that you support the ban. Support SB 128. What SB 28 does, it allows a mentally competent, terminally ill, in their final stages to request medication from their physician. SB 128 also, in the legislation, safeguards physicians, pharmacists, healthcare providers, and it keeps them immune from civil and criminal liability as well as professional disciplinary action. It also, SB 128, protects vulnerable patients that may be persuaded by family members, or if a family member were to fraudulently request the medication, they will be charged with the felony penalties. Also, Ira Bach, the same physician, stated, if the bill fails, supporters promise a ballot initiative in 2016. Brittany Maynard, in her article dated October 7th, 2014 in CNN.com, she stated she would not tell another person they should choose death with dignity, but then ask, who has the right to tell me that I don't deserve the choice? No one has the right to legislate someone else's life. As a matter of fact, I have a friend who we spoke often last year, and she had some religious disagreements. But I don't believe we have a mean God. That's my own preference. Also, not everybody, it's allowing the people who need to make the choice, that it's there for them. It may not be a choice for all of us, but it's available for those who do and will be suffering. I've reviewed for you, we've talked about the problems with the banning of physician-assisted suicide in California, the cause of the problems with banning of that, physician-assisted suicide, and we've talked about the solution. So you need to call your local senator for your area and just let them, you can send an email or you can call and just let them know you support SB 128. Dr. Mike Turbo, oncologist from Palo Alto, stated in an April 7th, 2015 article with Compassions and Choices.com, as an oncologist, I've learned many patients just can't be cured. Some people's problems can't be fixed. Hippocrates, father of Western medicine, taught his students in ancient Greece, cure sometimes, comfort always. From his perspective, comforting a dying patient and relieving their suffering is the highest form of healing.